So head and neck cancer is one of the unique cancers in that it really is a very multidisciplinary treatment paradigm. In order to make a treatment decision, it's not just about how do we cure the cancer, how do we attain the best survival. You really need the input of the supportive oncology services, the speech and swallow specialist, the dietitian and the psychologist are essential in helping us cultivate a plan. So the Pretreatment Clinic, or as we like to call it, the Cancer Boot Camp, is something that we innovated here, which is a coordinated team of people that sees the patient prior to their cancer treatment, and it fulfills many different important aspects of their cancer care. It gives the patient an idea of what to expect prior to treatment. It gives them an opportunity to meet the team that's going to be working with them prior to treatment and through treatment, and then as they're finished with treatment, to get them back on their feet in the rehabilitation process. So Al was specifically referred to me to be evaluated for sort of the most contemporary options for the treatment of his cancer, which was a base of tongue cancer with a lymph node metastasis to the neck.
They went through about every aspect that you could possibly think of for treatment and for side effects, and to prepare you. The hearing tests and all the different things that you have to have, and you think, why are they giving me a hearing test? And then you find out. And why are they giving me swallow exercises? Then you find out. And all the other things that there was dozens. I mean, they really prepare you well.
When I spoke with him and got to know him a little bit better and understood what his goals of care were, I was able to help customize essentially a personal treatment plan for him. Something that you and I as a normal average person not notice, but as a broadcaster, he would probably notice a difference. And so with that in mind, I wanted to be very careful about what treatment options I recommended to him. That's why I relied heavily on our pre and post-treatment clinic.
With my job as a broadcaster, my voice is very important to me. The reason that they went the path that they decided to go was because the tumor was right next to my vocal cords, and they said just a slight error would change my voice drastically.
The post-treatment clinic is something also that we didn't originally innovate. It was from listening to our patients and hearing from them that after cancer treatment ends, sometimes with all the attention that they get during treatment, they felt like there was an abandonment. So what we established was a post-treatment clinic. It's a check-in with the team, the swallow specialist, the psychologist, and the dietitian to see how is everything going with your quality of life? How are you transitioning to cancer survivor?
And I figured, who has better control of my voice than me? Well, I was wrong. 2 or 3 weeks after treatment stopped, where I couldn't even talk. I got it back through the exercises they gave me. All the pieces of the puzzle started coming together. A couple of weeks, 3 weeks into recovery, and then things started getting better.